all
Oh my God.
Isn't that nice?
Okie doke. We want to take some of this old...
Will you save them for me?
Absolutely.
We're going to take off some of this old blood here. Okay, just gently pat it.
You
I am
just,
just very young, honey.
Gently pat it. I'm going to let that soak a little bit here.
you just look at me and I bleed.
Yeah, you have very tender skin.
Well, that's because I'm so old.
No, I think maybe from a lot of prednisone use.
Yeah,
And it changes the chemistry of the skin.
yeah.
It makes it thinner, it makes it bruise easy, and it makes it bleed easier.
Right.
So it's like a triple whammy. Prednisone does help a lot in, being an anti-inflammatory for the breathing, but it's got a lot of potential side effects.
If you want to send the chair in,
Oh, well, I'm fine, dear. Now, as long as you're comfortable, I'm good. So basically what we wanted to do was just clean up the old wounds. This is a skin tear, and that's a skin tear. And this one is the little cancer removal you had. It's just a lesion at this point.
Yeah.
There's no depth to it. On the contrary, it's a little bit raised. Okay. Let's see if we come up with anything more after we
You want me to put this in the fridge
dab it.
until you finish?
I don't know how soft it is.
Yeah, I got the flowers
Uh-huh.
candy from a neighbor that used to live here. And me.
Yeah, send her a box of chocolates and flowers. He always do that.
Yeah, Andy always.
Yeah, always.
Okay. Now what I want to do next is put a little antibiotic ointment on there so that we protect the top layers of skin from any additional bacteria.
Can I have some wine there, lady?
I don't see why not,
You don't put the wine in the bandage.
but we don't put the wine in the bandage.
Oh, okay.
It's not part of the plan of care. That would be a no-no. Yeah, I don't think the doctor would be very happy with that. That would be a new type of wound care dressing.
The Chardonnay wound care.
Yes. Chardonnay wet to dry.
Something different.
Okay. So next I'm going to put some antibiotic ointment first on your post-operative lesion here, which is what Dr. Lopez, I guess, addressed. Then I'm going to go to the skin tear, which looks like 50% better in the last 2 days.
Oh, good.
It's what we have here is a little rolled up skin. That's what a skin tear is, and we're going to have new skin grow over that area. Okay. Throw that out there.
I got a big.
Yeah. Now I want to do the top skin tear there. Okay. And obviously your skin is very thin, so you're prone to getting these skin tears. So we gotta be very gentle. Be very, very gentle with you. Okay. Alrighty.
Now you gotta put something over that.
Of course. Absolutely. I gotta cover it with some non-adhesive gauze. Remember the first day, the trouble we had taking it off? It all meshed into the wound.
Yeah.
Because they had, you had some dressing that adhered to the wound. It was regular gauze.
I want you to put something on my elbow.
Absolutely.
What's on your elbow, though?
Not a problem.
Let me see what's there. Maybe it's under one.
Yeah.
Yeah,
It seems like it come down a little.
yeah,
Wow.
that, I want them to put something on there.
Okay, we're gonna put some Adaptic, which is a, basically a, type of gauze that has a barrier on it with, which prevents it from sticking to the skin. Okay. Now we're ready to wrap it up. I think being that you didn't have much drainage now, we can just put the roll of Curlex, which is a big roll of gauze over it.
You're not gonna put the other thing on?
You mean the 4x4s and all that? This is the same as putting a bunch of 4x4s, okay? I don't need the 4x4s right now because you don't have that much drainage.
Oh, okay.
I can if she were really draining a lot for it to catch it, but whatever drainage will come through, and very little does come through with this barrier, could be caught by this.
Okay.
Because I didn't see anything on the outside of this when I just took it off.
Okay.
Okay?
Yes.
But this is like, you know the 4x4s? It's basically made out of the same material, only this isn't a roll. So I'm just going to roll her leg with that, okay?
No, I mean the barrier you usually put over.
Oh, something over the barrier?
Yeah, you know that.
Well, this is the barrier dressing.
No, not that.
Oh, you're talking about the Telfa?
Yeah.
Yeah, I don't need it because this is in lieu of Telfa.
Oh,
Yeah, it's either the Telfa or that. Yeah.
Okay.
Yeah, as long as I have a non-adherent dressing, I'm happy.
Okay.
Okay? Okay. All right.
Can you put something over there, Lord?
Yeah.
Sure, I can.
I guess it came off of the hospital. It was a big one. I'm surprised. And you see that thing I showed you yesterday? See, part of it came off.
It came off. It looks like a calcification there.
Yeah.
Yeah.
Okay. So we're going to gently use this roll gauze over the areas we just dressed.
Okay.
And now we'll tape it up. Or as they say in the OR, we're ready to close. So these should be done within a few days, these skin tears.
Yeah.
Okay, so...
Don't forget to thank them for my nice guys. Nice people that...
What I'm going to do, sorry about that, is just tape a little bit. I don't like putting tape right on her skin, but this is an area which is very mobile, the joint, so it's liable to slide off.
Put something on there.
Yeah, I'll take care of that in a minute, hon.
Yeah.
I wonder how that came off. Look, it was a thick wad. Unless the doctor take it off and we didn't know.
No.
So how come it come off?
I don't know. It fell off, I guess.
I guess.
Okay. I want to very, very lightly put on maybe a 1/4 inch of the tape to hold around the knee so that it doesn't slide down.
Okay.
I tried to put a tube gauze on her, but it was too tight.
Yeah.
And she does tend to swell and then unswell, so then that would be stretched out, you know? And this stayed last night, so...
Yeah, it did.
So that'll be good. Okay. And you know that, you see anything unusual with the dressing, any drainage that's coming out that looks abnormal, you could always call me.
Oh, okay.
Okay, very good. Now, your elbow.
Just put something over there.
Okay, well, you got little skin tears all over, but they're dried out.
These are dry, yeah.
All right. Let me get off your arm, what you got there. Well, let me get this one first, dear. Look at that. That looks like an old hematoma from when she was in the hospital.